I've handled medical emergencies up in the air, but never at sea. Let's check out what medical injuries and situations can happen when you're on the Deadliest catch. Let's get started. Be-whoop.
228 miles southwest of Dutch Harbor.
Ooh.
While setting, a rogue wave ambushes the Patricia Lee from the starboard stern.
Oh my God, if waves come onto the ship like this, you can just get sucked out to sea. How can anyone ever save you? This ship can barely handle it.
Ejecting the anchor pot out of the ramp, crushing 29-year-old deckhand Francis Katungan against the stack.
Oh my God, is he being pinned?
Pulse, broken hips, right? Yeah, probably.
Oh my God, how do they know that it's a broken hip? That's unbelievable. Based on the way that fracture happened, probably a femoral neck, maybe intertrochanteric fracture.
I feel the pain every time the motor rolls.
Yeah, hip fracture is very painful, usually needs morphine pretty quickly. Another thing you want to be concerned about, given the fact that where he was hit, that he's not having any intra-abdominal or chest bleeding, because bleeding into those areas can be problematic. Obviously, losing blood anywhere is bad, but you could lose a ton of blood without realizing it into the retroperitoneal or peritoneal space. And in the chest, it could impact your heart's ability to beat, which obviously is lethal.
3 hours after being crushed by 2,000 pounds of steel.
This guy, they don't secure the steel?
I can't take any chances with having internal bleeding.
That's what I was gonna say. Internal bleeding is obviously the biggest risk, but also if there's a femur fracture, you could be worried about developing a fatty embolus, where actually from the bone breaking, a piece of fat can travel into the circulatory system and get lodged in the lungs, leading to someone dying.
Deckhand Francis Katungan suffers from blunt force trauma to his pelvis and possible life-threatening injury to the iliac artery.
A lot of these concerns can be ruled out by checking simple vitals. Even having a pulse oximeter, being able to check oxygen status and pulse, give you a good amount of information, because if someone's pulse is normal, odds are they're not losing a lot of blood, especially if they're not pale. But you definitely want to keep monitoring them, because a situation like that can deteriorate quite quickly, especially based on the mechanism of injury.
With the MH-60 Jayhawk batted by 30 knot headwinds, the Coast Guard now has only 20 minutes to lower the rescue swimmer to the pitching deck, secure Francis, and hoist each of them back up.
And imagine how much that's gonna hurt. He's in severe pain even when the ship rocks. Pain control here is of utmost importance.
Don't go to sleep. Yeah, stay with us, buddy.
I wish they told us his vitals, blood pressure and pulse would go a long way to understanding his cardiac output.
I don't see how they're gonna do this. It's just not. Here he is. Me. No way.
Badass, that's what I'm talking about. Medical rescue. This is basically what I do no, it's not at all.
Whoa. Roll on your right side, bud. Roger.
Oh man, he's in so much pain. They got to get a backboard on there to hoist him up. That's another thing we didn't even discuss, whether or not he has sacral or lumbosacral fractures.
It does not get any more intense.
Oh my God, it looks like they're faking the waves, but this is real life. Oh my God, that can't be comfortable. Oh my God, I'm so worried that he's gonna hit his head or something. Did they at least put him in a helmet?
10 hours after his injury.
Is he passed out from the medications or from the condition? Because then I'm really worried about checking his pulse, making sure that we don't need to do chest compressions.
Hey guys, I just talked to Francis' doctor, and he's gonna be okay.
Wow.
He's gonna be fine, so yeah, that's good news.
That's amazing news. The fact that the Coast Guard came in there and they put him on the winch. Oh my God, why are their faces always making contact with the rusty bucket, crab bucket? Oh, it's his finger?
42-year-old deck boss Mike Vanderveld slipped. Got his finger caught between the launcher and the 800-pound crab pot.
Oh, he lost full on the fingertip. See, given the fact of where he is and the fact that it's just the tip, it's probably not going to be reattached. Just about washing it out with saline, dressing it really well to prevent future bleeding, and getting him to a hand surgeon. That's all you could really do in a scenario like this. And some people, if they, lose a finger, they'll throw it on ice. Don't do that. That actually damages the finger. What you should do is wrap it up in a towel, paper towel, ideally something sterile, but if you don't have anything, just a paper towel, and then take that and put that on ice so that the finger itself is not making contact with the ice, and keeping the hand that's bleeding above the heart, which decreases the amount of blood flow, therefore decreasing the amount of blood loss. And obviously with an open wound like that, out in sea, dirty wound, you need antibiotics. You're worried about osteomyelitis because there's a lot of small bones in the finger that can get infected. Septic arthritis, the joints can get infected. Those now require IV antibiotics if that were to happen. So that's why in a scenario like this, just massive amount of saline just to wash it off, and then pressure, pressure, pressure.
Put compression on it right now. Wrap it up no matter how bad it hurts. You need to wrap it up. Control the bleed.
And in these scenarios, what I see patients do is they put a lot of pressure, 30 seconds, a minute, and they go, let me see if it's still bleeding. Not enough. At least 10 minutes before you reassess. Maybe even 15 in some scenarios.
Oh, you gotta put it in there and rinse it. Okay, pull it out. Okay, this is gonna hurt.
This I don't necessarily like. I think rinsing it is usually enough. Putting any kind of alcohol, peroxide can actually irritate the tissue.
Okay, let go of these. Hold with that hand.
Hold it hard. You gotta be squeezing.
Try to calm down and control.
Yep, look at that, above the head. Good job. No, put it back up there. Yeah, that's just the angle. It's too small. I don't think that's ever gonna be reattached. Oh, what happened here? Oh, I know what happened here. A serious fracture happened there of what looks like to be the tibia.
2 hours ago, deckhand Cody Rhodes took the falling force of a 1,000-pound steel crab pot to his left leg.
My God, that's a bad fracture.
Twisting the flesh and bone, resulting in a gruesome spiral fracture.
Oh, a spiral fracture from the force, just literally circumferentially just breaking the bone
of his fibula and tibia.
So both of the shin bones are broken, not just the tibia. And usually that happens from a very high velocity, high weight fall, unless you're someone who's older and has osteoporosis. You need open reduction internal fixation here, which is a surgery where they basically put hardware in and allow the bones to heal, because bones are really cool. If you put them together, they heal.
Even in a trip's final moments, one man learns the hard way just how unforgiving the Bering Sea can be.
That's a really good pain control method, the fact that it's inflated like that. I wonder if these guys have really good life and health insurance.
On the Cape Caution.
Hold on to that pot, Greenhorn!
Oh my God, did he get cracked in the face?
Hey, just stay down.
Is there no better way to get crabs out of the ocean into the ship? Oh my God, that's a broken nose. That doesn't look straight. I'm concerned about that. You gotta be careful for a septal hematoma too. That buildup of the hematoma, which is basically just a collection of blood, it can put so much pressure that it can lead to necrosis and totally destroy the septum there.
How you feel? Are you dizzy at all?
I can't tell.
Obviously, because it's a head injury, you gotta rule out a concussion as well.
We need to put pressure on this. It's gonna hurt, okay?
Oh yeah, it's gonna hurt.
And the pot hit the bone
Oh.
and bounced back. Hit him in the nose, broke his nose.
I mean, besides putting pressure on the area, there's not much you can do. Given that this was like a rusty cage that ended up hitting him, I would want to make sure his tetanus vaccines are up to date as well. If it's been more than 10 years, you obviously need treatment. In certain situations, if a deep or dirty wound, even 5 years is not enough.
Are you all right?
I feel like there's always an to start a scene.
Are you all right?
Oh my God, is he just down?
Hey, bro.
If you see your loved one in the middle of the day fall face flat, down, not get up, you don't need to ask, hey buddy, are you all right? You can right away start calling for help and trying to see if they have a pulse, if they're breathing. And if not, you know what to do. Say it with me. Chest compressions, chest compressions, chest compressions.
Are you okay?
Is he joking right now? I feel like this is a skit. No, he's not. He's not faking it, just taking a nap on the ground.
There's baby aspirin right now.
Baby aspirin? Is he having a heart attack?
No way. Good. Yes. Give me those, and then you want go ahead and get the chest and see if you got the nitro in there, would you?
Oh, nitro. He really thinks he's having a heart attack. So nitroglycerin is a type of medication that reduces pressure in the vasculature, essentially lowering blood pressure, allowing the arteries to relax. And when that happens, usually you can get blood flow to areas that were blocked off, usually in your heart, related to coronary arteries. We used to recommend that adults call 911 and then right away chew up a baby aspirin or a low dose aspirin. We don't give aspirin to babies, that's why we changed that. But now we've moved away from it unless your doctor explicitly recommends that you take the medication, because it wasn't right for everybody and it did cause some adverse events.
Left side. No.
How does he know it's not a stroke?
You what? You're kidding. Can you get a hold of the clinic?
The clinic? Get him off the ship!
This is Dr. Miller. I've gotten a little background on the situation.
Yeah, we have a person who seems to be having a heart attack. I would do more of a neurologic exam and confirm that it is in fact a heart attack as opposed to a stroke. Remember, BFAST is the acronym for stroke-related symptoms.
At this point, my concern is that he possibly had possibly a mini stroke. Do you happen to have a heart rate, Captain?
We don't have a heart.
Why does no one on a ship that is always at sea not know the basics of how to check a pulse? Even these days, the camera on the iPhone can take a pulse. Apple Watches take a pulse. It really doesn't require much skill set to check a pulse.
He's still really stressed out. Fall? You know, on the back, what back cross, everything else, right?
You're fair.
Yeah,
Oh my God, he cracked his head too. Why is he walking around?
you're bleeding.
This is the most nonchalant crew. They're guys laying on the floor. No one checks his pulse. They let him walk up and down the steps while the guy's having a stroke. We don't know if the stroke is hemorrhagic or ischemic. Remember, a hemorrhagic stroke means you're bleeding out. Ischemic means that you're not getting enough circulation and oxygen because of a blockage. So he just took aspirin. If he had a hemorrhagic stroke and he took aspirin, he's gonna make it worse. So I don't know there is no logic to what's happening right now. And the fact that he fell and he's bleeding, because aspirin impairs platelet function, it's gonna bleed uncontrollably unless you put really good pressure on it.
The initial incident, did he start feeling numb on the side of his body, or did he start by having chest pain?
See, the doctor's trying to ask questions from the history perspective to figure out if this is a heart attack or stroke. It's leaning more stroke now, but initially when he was grabbing at his chest asking for nitroglycerin, saying left-sided symptoms, could have been more heart attack.
Were you having any chest pains before you fell? No, I fell.
The fact that he's having word-finding difficulties also, this aphasia is making me nervous that it's a stroke.
Okay, so now let me just give you his blood pressure. 150 over 120.
Oh, that's really high. The diastolic number, the lower number.
So, I would say a mini stroke, an early stroke. It could be that, he had a TIA, trans-ischemic attack.
A TIA is like a mini stroke, where it's a transient ischemic attack where you start having some neurologic symptoms and they quickly resolve. But this doesn't seem to be that. It seems like a full-on stroke given the fact that the symptoms keep going. He's probably gonna have to be put on anticoagulation to make sure more clots don't form. And he needs good quality blood pressure control. That's most important. He suffered a mini stroke but returned for the following season. Wow.
We've got a serious injury on board. The guy got his fingers into a fish grinder.
Oh my God. Not only does that hurt so much because there's so many nerves that innervate the fingertips because you have some of your greatest fine point sensation, but that's not really fixable because that's not a clean slice of a finger that you could reattach. That's grinded. It's no good. And a lot of bleeding.
The discussion from the beginning was, is there anything to save on the fingers? You're probably gonna need to see a hand surgeon.
Probably. You're definitely gonna need to see a hand surgeon.
Couldn't get all my glove off.
Oh,
my still on there.
How is he not writhing in pain? I'm so impressed. See, look, this is how we clean wounds in the hospital. Just saline.
An x-ray will show the doctors the full extent of his injuries.
Because remember, x-rays show the bones, because you could see the soft tissue injuries, but then you'd want to see how much of the bone is there to decide whether or not any kind of reattachment or correction can be made. Oh, man.
You got a fracture right in here.
I don't know if they're going to be able to save those 2 digits there.
I took a little tumble and I think I pulled my toenail back too far, so it's been throbbing, it's all swollen.
Ah, that's so painful. It's like an avulsed nail bed. Why are they wearing Crocs on the ship? I feel like they need to have more strong footwear.
Looking at this, you can have an infection, potentially needs its help. So, about to beat the needle up and let the blood out.
Letting the blood out plays no role in the infection, but it can make the area more comfortable because what he could be developing is known as a subungual hematoma. There's a pocket of blood, but because it's underneath the nail, it builds up, that pressure builds up, it's quite uncomfortable. So you heat up a piece of metal, and I don't ever recommend people just do this on their own, but they heat it up, they put it against the nail, it creates an opening, blood comes out, pressure gets resolved.
Oh, yeah. Got that oh, there's in there.
I believe that's more injury related than infection related. I obviously didn't see it super carefully, but if you see a lot of pus, that is now pointing to a paronychia, an infectious state that perhaps would warrant either antibiotic soaks or even oral antibiotic medicine.
You okay? And do you feel like dizzy? Is it hard to walk right now? I just need minutes to sick, that's all.
Maybe get the cigarette out of his face.
I had like an ingrown hair. It's turned into quite the blister.
Oh, where is it? Where is it? Ingrown hair? Is it in the groin?
Hurts at the moment.
And you know what's terrible for healing wounds? Smoking. It's one of the big conversations I have with my patients who are about to undergo surgery, and I tell them that the rate of complication is higher, not just because their cardiovascular risk is higher, their healing abilities is depressed.
I've got my scalpel, got some alcohol wipes, got some lidocaine to numb the area for him. I'm gonna lance it open, and we're gonna get all that stuff out of there.
I'm curious if this is a cyst or is this an abscess? Because if it's an abscess, that's a walled off infection. And actually the treatment for an abscess, most people think because it's infection is antibiotics. It's actually incision and drainage, where you let the fluid to drain out, the pus and all the bacteria out of there, and it should heal on its own, just because the body basically walled off that section of bacteria away from itself. Oh, it's in the armpit. This is almost like, it's a furnicle. That's what I would call this. It's an infected hair follicle. There is a condition called hidradenitis suppurativa, which people get recurrent infections like this under their armpits, sometimes in their groin, and it's very, very uncomfortable.
Are you ready?
Oh no, don't have a wave hit him. This is definitely editing. I have a feeling it didn't happen this way.
Oh, yeah.
This is where having a lot of gauze ready to go is very valuable. See, a lot of times it'll come out, but then sometimes there's cavitations inside the cyst or the abscess where you have to sometimes go in with a Q-tip and break those walls to get the rest of the fluid out. And the idea is not to have that area closed. You'd want to keep it moist, you want to keep it wet so that it continues to drain. So putting warmth on that area is going to be very smart, and checking it daily to make sure redness is not starting to spread from the area or streak, because that could be a sign of cellulitis. There are some sports I think should be illegal. Click here to check that out, and as always, stay happy and healthy.